everyone. Happy Wednesday, I believe it is. My name is Katie Earle. I'm the coordinator of the University Express program, and we're joined today with Darcie Hanson from BlueCross BlueShield of Western New York. Darcie, thanks for being here.
You're welcome. Thanks for having me.
Thank you. Of course, and thank you to everyone who's here with us today. It looks like we have some new folks, so I'll just quickly run through my housekeeping. We are recording the session, and I will try to post it on our website at some point this week. You might think you're the only one in here, but as you've heard me say, there are other people. It's just that we're in an anonymous participation mode. So you think you're the only one, but you're not. And you've joined muted and without your video showing, and those are just the settings for the program today. It's not because you've done anything wrong. So as we go through Darcie's presentation, if you have any questions, please type those in your Q&A panel, and we'll get to those when we have a chance. If you're new to us, your Q&A panel can be located on the bottom right-hand side of your screen if you're on a computer. If you're on a tablet or smartphone, poke or touch your screen. That'll bring up your control panel, and then you'll be able to find your Q&A panel. So we'd like to thank our sponsors. It's my Department of Senior Services, BlueCross BlueShield of Western New York, Excelsior Orthopedics, and Wegmans for everything they do for our program. And we at Senior Services are always here for you. We're at 858-8526. Now, enough about us. Let's learn about Darcie. Darcie has been at BlueCross BlueShield of Western New York for almost 5 years in her role as a registered nurse. In addition to this, she is a per diem nurse on a medical surgical floor at Bertrand Chaffee Hospital. She also has a background in social work education. Darcie has been teaching classes for University Express since 2019 and enjoys being able to present on different health topics that affect many people in our community, such as this today. Darcie, thank you. The floor is yours.
All right, awesome. Thank you very much. Welcome, everyone. Thanks for joining today on the vitamin D presentation. I'll go ahead and get started. If you have any questions, you can, chat or type them in, and we can stop and answer along the way, or you can wait till the end, whatever you're most comfortable with. So the vitamin D is also known as the sunshine vitamin. So let's get to this. Wait, why am I not moving now here? Okay, there we go. So the sunshine vitamin, vitamin D. So the best way to get vitamin D is to expose your skin to natural sunlight. We're going to actually get into more of this slide throughout the presentation. As I'm looking at this, I feel like I may need to move this slide because I'm not sure if it makes sense in the beginning, but let's just go over this and we'll dig deeper into each of these. So like I had just mentioned, the best way to get vitamin D is exposing your skin to natural sunlight. So your skin is exposed to the UVB rays and absorbs in the vitamin D. A little side note that vitamin D is activated by the liver and kidneys to work. Another way to get vitamin D is also a vitamin D3 supplement when natural sunlight's not an option. And again, we're going to talk a little bit more about each one of these throughout this presentation. Okay, so vitamin D is a fat-soluble vitamin. So it's stored in the body for a longer period of time. And it uses your fat to store it in the body. So other vitamins like that are A, D, E, and K. It actually works like a hormone. So it goes through a process. So I can see this. I'm sorry, excuse me for 1 second. It actually works like a hormone. So it helps to absorb calcium and distribute that throughout your body. A quick little side note, no other vitamin goes through the process of activation. So it needs the liver and the kidneys to activate in your body that vitamin D does before it can be used in our body. So that's just a little background about vitamin D. Okay, so why do we need vitamin D? So I'm going to go through some reasons as to why vitamin D is important to us. And normally when we have done this in the past in person, it's nice because we can kind of all talk about what we think before we move on. So obviously we have to kind of bear and grin like this for now, but that's okay. Okay, so these are some of the reasons why vitamin D is important to us. It helps with your bone strength. It regulates your hunger. Fall prevention, and that kind of falls in with the bone strength. So when your bones are, weak or brittle, obviously you're more likely to maybe have a fall than if you had strong, healthy bones. Prevents cancer growth. It helps to improve your mood, your mental performance. It regulates blood pressure and heart health, and it helps to improve your immune system. So looking at this list, these are all pretty important things that most people or some people don't even know what vitamin D, why vitamin D would even be important. So like I had mentioned with the bone strength part, it helps to absorb calcium and helps to maintain bone mass. And if you have those low levels of vitamin D, that's when you can cause your bones to become thin, brittle. That's when you have those falls and breaks and things like that. So a lot of people after, I believe it's the age 65, they may be advised to have a bone density scan from your doctor. So that may be something that you may be wanting to talk to your doctor about if you're at that age, or if you're having any issues, that may be something they suggest as well. So I wanted to touch on vitamin D for the immune system. So this is kind of the slide. If you can't see it, it's basically just a couple of pictures of cells, and it talks a little bit about how it helps with the cytokine production, which is one of our cells that help with our immune system. They're secreted by the immune system when you're not feeling well. So vitamin D helps to produce these cells and stimulate them. So if you get sick, they kind of attack where you're not, like, they sort of attack the sickness to help you to help you get better. They move towards the inflammation, infection, and trauma and work at it healing. I wanted to touch base on, I know obviously COVID is like huge right now and everybody's talking about what we can do and what we can take. Vitamin D is good for your immune system. So it is not a bad thing to have enough vitamin D. Catherine mentioned I work in the hospital per diem, and patients that have COVID or recovering from COVID, we do give them vitamin D, vitamin C, and zinc. So these are all good vitamins for your immune system. I don't want anyone to think, oh, if I take vitamin D, I'll never get sick or I'll never get, COVID. And that's just, it's not a magic vitamin like that, in the sense that you should take it to help with your immune system to prevent that, but it's not the end all be all kind of thing. But I just wanted to make sure I touched on that, because I know a lot of people have asked about, maybe not in this class, but different members I've spoke to and stuff. And I just want to encourage everybody to definitely have enough vitamin D and take these vitamins, but just know that, you still can get sick and things like that, but this will help the effects of it more, if that makes sense. Okay, so a lot of people have no idea whether or not they're deficient in vitamin D. So like as the slide is saying, so it's estimated that 85% of people have insufficient vitamin D levels. So when you go for your yearly blood work, it's not always something that your doctor may check. So you might want to ask, if you're not sure if I'm deficient, you may want to ask, can you check my vitamin D? Is that something that you normally check? Run that by your doctor so you kind of know where you land. When I've done this presentation in person, some people have said that they had to ask their doctor, or there may be a cost to have it done. I don't know how everyone's insurance is, so that's maybe obviously something you would want to check before you went ahead and did it. But it's definitely a good idea if you're not sure where you're at, or you're not able to get a lot of vitamin D, to see what your number may be. So I listed the blood test that you would want to talk about, the 25 hydroxy vitamin D blood test. And I also put the good levels in here as a reference for you, in case you've had blood work and that is something that your doctor has tested. You can go back and check. So the 20 nanograms per milliliter to 100 is the adequate amount for healthy people. So just something to keep in mind, that again, this is not something that's always regularly tested. So good to know when you're going in for your blood work, if that's something you should be asking your doctor about. Okay. Everybody who's at risk for low vitamin D, basically everyone in the winter months. And it's just makes sense with the fact that there's really not a lot of sun coming through to be exposed to through the vitamin D. So regardless, everybody is at risk. Darker skins, it's just the way the skin, the UVB rays, they don't absorb into the skin as well. Pregnant women and elderly population. And we'll get into a little bit more about the elderly population as to why it seems that they may be more at risk for low vitamin D. again, if you have questions, feel free to, because I know I'm kind of going through this, so don't be afraid to stop me. So these are just a few little reasons why there may be a vitamin D deficiency. So tall buildings, pollution will block the UVB rays. I mentioned earlier with the sun, with the winter, I don't have that on there, I don't know why, but with the winter, the weather, the use of sunblock in clothing to block rays, and the fear of skin cancer has caused many people to avoid the sun. So we're going to get a little bit more into the skin cancer part in another slide about how much you really need for vitamin D to actually help. But these are just some of the reasons why you may be deficient in it. So when somebody, So vitamin C deficiency risk. So when you don't have enough vitamin D, you're at risk for arterial stiffness, risk of heart attacks. So basically arteries are getting stiff, blocked, could cause issues with your heart, your bone pain, which is something we kind of touched about with the bones, osteomalacia, soft bones, fractures, osteoporosis, cancer, stroke, and rickets, which is primarily children. So these are just a few of the risks that that may happen if you don't have enough vitamin D. So how much vitamin D do you actually need? So really, you just need 10 to 15 minutes of sun twice a week. So we're not talking about an excessive amount of sunlight, just about that much to be sufficient for you. Of course, time of day, exposure, location, season, clouds, all those things, skin color play into this. I've had people ask before if I'm in my car or if I'm sitting next to my window and it's sunny out, you're still not getting it. You can't, sitting through a window is not going to expose you as well as if you were outside. So just keep that in mind. When I have done this before, people were worried, about the skin cancer and having your body exposed to a lot of sun. Again, you just need a few amount, but you can even get it like through your hands. So if you're outside mowing the lawn and you have a shirt on, or you're at the beach and you have a long shirt on or a sun hat, you don't need to have a lot of your skin area exposed for that vitamin D to come in. So just be aware of that too. It can absorb in any part of your body. So don't feel like you have to go out with, if you're mowing the lawn with, tank tops and shorts on, if you're uncomfortable with that, just cover up the way you would like, and just a little amount of your skin just has to be exposed for that vitamin D to come in. 2,000 international units a day of vitamin D3 is a good amount. People have asked, like, if I want to take a supplement, that's usually like a decent amount that we would recommend. Keep in mind when you're looking for the vitamin, if you decide you want to do a supplement, if you're looking for vitamin D3 or vitamin D, the D3 is the one you would want to get because you need sunlight to convert the D2. So look for vitamin D3. I always tell everybody though, before you start taking a supplement or anything like that, make sure you run it by your doctor, just because I don't know what everybody is taking. And I don't know if a medication you may be on may, interact poorly with it, or it likely may not, but it's always a wise idea just to let your doctor know or ask them, do you think I should take a vitamin D supplement? The skin produces
Darcie?
Yeah?
We have a question that just came through, actually.
Okay.
This person's wondering, what's the difference between vitamin D3 and vitamin D2?
So if you take the vitamin D3, your body will absorb it and use it through the supplement. With the vitamin D2, you would need to have sunlight as well to convert it, to convert it and your body absorb it. So if you don't go out in the sun a lot, or you don't have that exposure, you would want to do the vitamin 3, because you're going to get that vitamin just through the, you're going to get the vitamin D just through taking the supplement. If you take a vitamin D2, you need to make sure you have sunlight as well to help convert it. So I hope that answers the question.
Thank you.
Okay. I'm sorry, I lost my train of thought. Skin absorbs 10,000 international units and 30 minutes of summer sun exposure. So think about that. That is a lot of vitamin D from being outside those 10 to 15 minutes twice a week, excuse me. So that's a lot. So that's definitely the sunlight is the best way to get this vitamin D. But again, you know, obviously when sometimes we cannot, the supplement is the second best way. Vitamin D, like I mentioned in the beginning of the slide, the presentation, it's absorbed by fat. So if you're taking it, you can take it with a healthy fat. Have it with a couple nuts or an avocado, and I listed coconut oil or olive oil, excuse me. So if you eat it with a healthy fat, it helps your body to absorb it better. Just looking to make sure I touched all my points on this. People will ask like about the vitamin D in foods, and I cannot find a lot of foods that have a lot of vitamin D. So foods in, you know, foods in nature, I've listed I couldn't find a lot. So wild caught salmon, mushrooms, they have to be exposed to UV light, liver, and egg yolks. So, or you could try the fortified foods where they put the vitamin D in, like the milk, yogurt, cheese, margarine, orange juice, some cereals, and breads. Those don't seem like so unrealistic, the fortified foods, but it's maybe not be enough for your body to get that normal level of vitamin D. There's not a ton to go off of, so that's why that supplement also is helpful. I try to find other ones to put on here, and I just don't seem to ever be able to find other foods. So I listed what I could, and you know, you can increase some of those as well if you think it would be helpful. But again, you can, you know, again, the supplement would definitely be most helpful if you can't get the sunlight. So when I mentioned the elderly population, a lot of times they do a lot, like they may have low vitamin D intake, less sunlight exposure, especially those in assisted living, because obviously they're not outside as much. And think about what happened this past year with COVID. They couldn't come in, they couldn't come out. You know, it was, I'm assuming there was not a lot of sunlight exposure just with everything that was going on. So their vitamin D levels may definitely be lower. And then aging naturally just reduces the body's ability to make vitamin D from sunlight. So that's kind of working against you as you get a little bit older. So that's why I just wanted to clarify why elderly population was on there, because of these few reasons. And again, I keep stressing that if you're not getting enough sun, you can eat the foods rich in vitamin D, or you talk to your doctor about taking the supplements. I have had people ask, can I get too much? And that's where this slide kind of came from. Yes, but it's very uncommon. So I have had people in the class before who have been sick. I believe somebody might have had cancer, where their doctor did prescribe a supplement of like 50,000 international units a day, but those are like extreme circumstances. So please don't do anything like that unless that's something that your doctor has spoke to you about. Excuse me. Those are rare situations where people need this to get better, or because they have a certain illness or something that's going on like that. Because if you start to take too much, it can calcify, you know, kidney, heart, lungs, eardrum, leading to deafness. So it's just going to cause other issues for you. Symptoms of that are headache and nausea, which basically are symptoms for everything these days. So you wouldn't even really know if it was the vitamin D or something else going on. You can never get too much vitamin D from the food or the sun. So that's mostly like a supplement issue. If you start taking all these supplements and not being recommended to do that by your doctor, that's what's going to cause these issues. Those are all of my slides. Does anybody have any questions? Or sometimes I always open it up to people sharing maybe an experience or something they found was really helpful to get their vitamin D up. Or is there anything like that I can help with, or you want to share with the group?
Thanks, Darcie, for the presentation. I'm actually looking at a couple questions right now.
Okay, so let's see.
The first one
go ahead.
Okay, sorry. The first one I'm seeing is, can vitamin D be absorbed through regular clothing and not special clothing?
So with the vitamin D in the sunlight, you want to have the skin exposed for it to absorb the best into your body. So like I had mentioned, like even if you're covered up and you're mowing the lawn and your hands are exposed, it's going to go in there through, it's not going to absorb as well through clothing. So I would have it, you may get it in your neck may be exposed a little bit, or your hands, but you only need a little bit of skin for that vitamin D to come in.
Okay, thank you. Mm-hmm. The next question I'm seeing is, does a sun lamp help?
And I want to say that at the one presentation we did, somebody had asked about that, and the other woman I was with had recommended that it wasn't as useful as the regular sunlight. So I don't believe that you can get the vitamin D from the sun lamp. I'm not 100% on that, but I'm thinking that's what we had talked about at that presentation. So the best way is the natural sunlight. Because I know sometimes people use those, isn't that like what is that one? I'm sorry, I'm losing when people with the mood, when it's like dreary all the time in the winter and people have those sun lamps and stuff, I believe that the best way is just the natural light.
Okay. Thank you. And seasonal affective disorder, I think, is what you're thinking of.
Thank you. That was on the tip of my tongue. I'm like, I know that we had talked about this. So yeah, I would say, if you want that natural sunlight or that exposure, to do the natural sunlight. Okay. Do you see that question about what is a normal vitamin D level?
Yeah, I do. I was getting to that. Go for it.
Okay. So in the one slide, I had said that a normal, and I'm going to just make sure I repeat this in case you have to write this down. A level of 20 nanograms per milliliter to 100 nanograms per milliliter. That's the normal level that you want to be in between those two numbers, 20 to 100. Okay. Let me see if I can find that slide. Oh, there it is. Okay. In case you want to copy that.
Thank you.
Can you get any vitamin D when wearing sunblock? I think it's probably possible to get some, but it may not be as effective as if you were exposed. So again, I don't want people to worry that they have to go outside with all of this skin exposed and you're going to get burnt, and we don't want that, obviously. So if you have some on, I'm assuming that you can still get some of that vitamin D absorbed in. But again, if you don't have like any on your hands or your neck or something like that, it's probably going to absorb in better that way.
Thanks, Darcie. Another question I'm seeing is, how does alcohol affect vitamin D absorption?
That is the first time anyone has ever asked me that, to be quite honest with you. And I'm not really sure I'm not really sure, actually. I know that the vitamin D is activated by the liver and kidneys. So I'm assuming if you have any issues with that, but I don't have any research on that. I could definitely get back to the person that's asking, but I'm thinking that it may not as much, but I actually don't know the answer to that. So I don't want to give any false answer. Do you want me to see if I can find any information on that? But and I can let that person know if they'd like, but I don't know if it affects it in such a substantial way that if you had something to drink and then you were out in the sun, I believe it's still absorbing into your body.
Okay, thanks. Yeah, if you happen to find something, I can pass it along to that person, or we can just keep it for the next time.
I'm going to definitely write that question down. Whoever asked is a good question, and make sure I follow up with that, because that's the first time I've ever been asked that.
Okay, let me know when you're ready for the next one.
Yeah, I'm ready.
Okay. This person's wondering, will I feel a certain way if I'm deficient, like sick or tired?
So I think what would happen is you may feel like, your mood may be kind of down, or you may notice that you're feeling a little bit weak, or, like I had mentioned, you may be feeling like you may be sick more often. It's not like a guarantee if you take vitamin D, you'll never get sick. But I think that if you start taking it, you'll notice you may feel your mood may improve. You may feel a little stronger. You may feel not as weak when you're moving around. Your bones are getting stronger. So I think on that aspect, you're definitely you may notice feeling better. Whereas like, I know, like, I don't, like, there's nothing like that stands out like, oh, I have shortness of breath, or I, this and that. It's nothing where you're going to be like, I think I'm deficient in vitamin D. Do you know what I'm saying? So I feel like once you start taking it, you may notice that, you're, like I said, you're feeling better, you feel stronger, you're not like as weak when you walk. So you're definitely seeing the effects of it. Your immune system's going to improve. So you may notice, hey, I don't feel, as stuffy as I normally do, or I'm not really that sick. Or it's, been the whole winter and maybe you haven't really gotten anything wrong and things like that. So I think you may notice it more on that side rather than warning signs. Does
Okay,
that make
thanks,
sense?
Darcie.
I hope that makes sense. I kind of went.
I think it does, and if we need some clarification, the person can re-ask the question, but I think that made sense. The last question I'm seeing is there a special name for the vitamin D test or just the vitamin D test?
So you can just, your doctor, you can ask, it's called a 25 hydroxy vitamin D test. So you probably don't even need the 25 hydroxy special wording. I would just ask your doctor about vitamin D. Now, if you get your results back, I don't know how it's listed on your blood work. If it says vitamin D, or I'm assuming it would, rather than 25 hydroxy. So just ask your doctor about vitamin D testing, and they should be able to order the right test. So do you see is it possible to have a normal 25 hydroxy blood test, Catherine?
I'm sorry, Darcie, my audio cut out. What did you just say?
So it looks like we have another question. I wasn't sure if you could see it about, is it possible to have a normal 25 hydroxy blood test, but can vary?
Mm-hmm.
So I think with that is yes, because it's probably going to vary based on like seasons and time of year and what in activity level. So if you went and got a blood test maybe in the middle of winter, your levels may be lower than if you go during the middle of the summer. So I think it can vary depending on lifestyle and winter, summer, things like that. Is this an extension of that question?
Mm-hmm.
Can vary between normal and abnormal after. I'm not sure if I understand. Was that part of the last question?
I think so, or maybe just confirming what you're saying.
Yeah, I think it can vary depending. Like I always wonder, I've actually not even, I think it would be good even for someone like myself, like to say, okay, if you get your blood work done in the winter months, what is it? Should I take, some people will do the blood work and take the supplement throughout the winter. And then maybe in the summer, they are more exposed to the sun. They may not need it as much, but it's that's kind of a conversation to have with the doctor to see like where you lie and if you should take it regardless. But yeah, I think it can vary depending on the situation. And like I said, your lifestyle at that moment and sun exposure and all those things.
Okay, thanks, Darcie. The last question that I'm seeing is, do older adults need to be in the sun longer to absorb vitamin D than, say, kids? So
I know I had mentioned that in the one slide I mentioned, what did I say about, let me just make sure I saw it. So how the aging reduces the body's ability to make sunlight. So I would say, and that's also a question I've never actually had. So that's another good one. But just from doing this and talking about it, I would say if it's the 10 to 15 minutes, you maybe, if you're the 15 minutes longer or 15 minutes would be able to absorb a little bit more than, let's say, a small child that doesn't have any issues with absorbing it. But I think in general, the 10 to 15 minutes twice a week seems to be the general census of what would be appropriate for, for most people.
Okay, thank you. I'm not seeing any other questions.
Okay, I just wanted to add too, if you're going outside for that 10 minutes or whatever, 15, and you're taking a supplement too, you're going to get well enough of that vitamin D that you need as well. So that's why I'm saying, like with the blood work, you may ask the doctor, should I get tested for this blood work now, or or the summer to see where, like, see what's most appropriate. And they may say, like, I just had my doctor's appointment and she's like, you should take a vitamin D. She didn't even ask about like, you know, summer, winter, whatever. She just recommended to take it in general. So maybe that's what your doctor will say, you know, regardless of the time of year, take the vitamin D. Maybe it won't hurt regardless, or maybe they'll say, oh, in the summer, if it's, you don't have to, or so just have that conversation with your doctor before you do any kind of supplement. I mean, I know it seems silly because you can buy it over the counter and you're like, it's just vitamin D, but again, maybe, you know, maybe you're taking something that would interact with it, or maybe your doctor wants you to get the blood work before you start. It just depends on the person, I think.
Thanks, Darcie. So another question came up, and you had touched on this, but this person is wondering, is it dangerous to take too much vitamin D3?
So yeah, I think, let me get to that slide too. So in case you guys want it. So I think it becomes dangerous in extreme high doses. And like what I was mentioning, that 50,000 international units a day, I'm not even sure where you would buy that, to be quite honest with you, or how many supplements, pills you would take. So you probably wouldn't even go that far. And sometimes people are prescribed by their doctor these large amounts for certain reasons. So I would say when I had mentioned, hold on, I'm sorry, I know I keep moving everything. The 2,000 international units a day of vitamin D probably would be a good number to hold you. I had talked to the dietitian about that number previously, and that was kind of where they lied too with that, a good dose to have, a daily dose. So I think it gets into the problem if you're taking those real high, like I would imagine like anything like 10, 20. I mean, I'm not, like I said, I'm not even sure where you would get a pill that big, or you probably would have to take a few. So I would stick near the 2,000 unless your doctor recommends you to take a different amount.
Okay.
They may say, oh, 1,000 is fine for you, you know, or 2,000. So, but that seems to be the range. That seems to be a good dose.
Okay, thanks, Darcie. That you actually answered the other questions that came through about a specific dosage or a maximum dosage. So
right, and again, in the one slide, I had mentioned that the skin produces 10,000 international units in 30 minutes of sun exposure. So if you're going out those 2 times, and of course you could go outside as much as you want, obviously, and do what you'd like, but if the skin produces that much in 30 minutes, I mean, you're exceeding the daily dose of how much vitamin D is great, you know, that you even need just in that sun exposure. So it's pretty cool, actually, if you think about it, like how your body does that. But maybe it's just cool because it's me, but I don't know. it's you know, it's a neat fact. And then there's another question about sunscreen effect of vitamin D, and I think any kind of sunscreen or clothing is not going to absorb that vitamin D as well. So just be mindful of that if you have a lot of sunscreen on. Yes.
Okay, thank you. We can give it another minute or so to see if we have any questions coming through, but I'm seeing 2 thank yous. Thank you so much for talking about this, and thank you. This is really informational.
Oh, awesome. Thank you very much for joining, and I'm glad that we had some interaction, because I know this can be not as comfortable over the computer and things like that. So I really appreciate everyone, you know, asking questions and, you know, just being patient with all this.
Thank you, Darcie. And we do have a question. Is this possible to be on YouTube? That's the hope. We are recording it. I'll try to post it on our website this week, and then I'll send it out in my weekly email Friday morning what classes were posted and recorded. So, I'm seeing one more thing that just popped through. So if I'm outside, I shouldn't take supplements.
So I think as far as that goes, you might want to talk. Some people will take the supplement year round, regardless of the weather. That's just what they're comfortable with, the conversation they've had with your doctor. I know I've had people say, I do more of a supplement during the winter months because I'm not exposed to the sun. So again, getting that blood work done just to kind of see where you lie might be a good start, and then kind of go from there. Or just having that conversation with your doctor. They may say, you know what, take the supplement all year. It's fine. It's not going to hurt anything. or they may say, okay, when you get more sun exposure throughout those summer months, you may not need the supplement. So definitely have that conversation with your doctor, even if it's even a quick one, just to double check before you start anything. That's what I would do. I'm going to take my supplement year round, and I'm outside in the sun a lot just because it's becoming part of my daily routine. So that might be something that you discover that you're going to do as well.
Thanks, Darcie. We have a person that says, I'm so happy to have joined after my WebEx illiteracy. Smile. Super happy you made it on with us. And
Right.
then I'm seeing the question that I'm not sure if you are, but do you have to take vitamin B with it for more absorption?
I have never heard that. I've just heard that, you know, you could take it with like a healthy fat will help it to absorb better. I'm curious if you've heard that from somewhere. I can look into that for next time, but I've only heard that the healthy fat will help it absorb in your body. Of course, it has to be activated by the liver and kidneys, but I've only heard the healthy fat. So that's interesting. I don't know that. I have never heard that. So I'll have to kind of peek into that. I'll write that one down too. They're good questions.
Right. Yeah, this is a really engaged group. I love it.
Yeah, I know, me too. I haven't gotten that very often on the WebEx and stuff.
The next question is, what about calcium?
So calcium is also a really good, and it's funny because I just went to my doctor's last week, and that was another thing that my doctor's like, you need to start taking calcium because that is so good just for bone strength in general. So definitely consider that if you're not getting enough calcium through foods. And of course, when she asked me if I am, and I'm like, maybe yogurt sometimes, like I just don't drink a lot of milk. Calcium is excellent vitamin to have for bone strength, strong bones. It's only going to be beneficial to you if you're not taking in enough calcium through foods. I mean, I know there's a lot more foods with calcium in them, but definitely not a bad idea to ask your doctor if you should be taking a calcium supplement. Sometimes people have a multivitamin that has a bunch of these things in it too as well. So keep an eye on that. Is it true of taking calcium with magnesium? I don't know. I'm not an expert at like the different vitamins, to be honest with you. I'm just kind of I don't know about taking calcium with magnesium, if that's going to help, to be honest with you. I'm not quite sure about that. I know calcium, magnesium's is good to have as well. Like you want these good magnesium levels and vitamin levels in your body. So sometimes a multivitamin will cover it, but I don't know about mixing the two, the benefits, to be quite honest with you. I haven't done any research on that. But I do know calcium supplement is definitely something to consider if you're not taking that in.
Thanks, Darcie. And actually, that's a good segue. So on June 10th at 10 a.m., we do have a pharmacist that's going to be talking. His presentation is all about supplements.
Oh my gosh, that's awesome. Yeah, that's a good one.
If that's something that interests you, you can register for that on our website at erie.gov/University Express.
Yeah, so the few people that are asking these questions, that might be something really to consider, because if that's what he's focusing on, that's pretty neat that you guys are offering that actually.
Mm-hmm. Thank you. Yep, it was something that we were able to fulfill because we had some questions about it. But I'm not seeing really anything else come through, Darcie. Are you?
Nope, that was the last one.
Okay, awesome. Well, Darcie, thank you so much for shining light on this topic for us.
Well, thank you guys, everybody, for having me. I do appreciate it.
All right, and to everyone who's here, thank you for your attendance. I hope everyone enjoys their day, and I'll try to post this later on this week, so enjoy.
Thank you. Have a great day, everyone.